The Heart's Electrical Symphony and ECG Journey. Welcome, future heart specialists, to London Heartbeat Z Academy. Today, we embark on an essential journey into the very language of the heart, the electrocardiogram, or ECG. Think of the ECG as a powerful magnifying glass, revealing the intricate electrical symphony that keeps life flowing. It's more than just squiggly lines. It's a window into the heart's health, a fundamental skill for every cardiologist. Let's decode its secrets, one wave at a time. Before we interpret the lines, let's revisit the heart's electrical foundation. Every heartbeat begins with a tiny spark, an electrical impulse generated by specialized cells. This impulse travels through the heart, causing muscle cells to contract, depolarization, and then relax, repolarization. The ECG machine records these changes in electrical potential on the body's surface. Our first wave is the gentle P wave. This small, rounded bump on the ECG strip represents atrial depolarization, the electrical activation of the atria. It's the signal for the atria to contract, pushing blood into the ventricles. A healthy P wave tells us the impulse started correctly in the sinoatrial SA node and spread smoothly through both atria. Following the P wave, we encounter the PR interval. This segment stretches from the beginning of the P wave to the start of the QRS complex. It signifies the time it takes for the electrical impulse to travel from the atria through the AV node and into the ventricles. The AV node acts like a crucial gatekeeper, briefly delaying the impulse to allow the ventricles to fill completely before contraction. Next, the most prominent feature, the QRS complex. This sharp, spiky trio of waves marks ventricular depolarization, the electrical activation of the ventricles. This is the powerful signal that triggers the massive contraction of the ventricles, ejecting blood into the body and lungs. Its shape and duration are critical indicators of ventricular health and conduction system integrity. After the QRS, we observe the ST segment. This is the flat line between the end of the S wave and the beginning of the T wave. It represents the plateau phase of ventricular repolarization, where the entire ventricular myocardium is depolarized. This segment is usually isoelectric, meaning it's at the baseline. Deviations from this baseline can be highly significant, often indicating myocardial ischemia or injury. The final major wave is the T wave. This broad, rounded wave represents ventricular repolarization, the electrical recovery of the ventricles. As the ventricular muscle cells relax and reset their electrical potential, the T wave is formed. Its morphology and direction are important, as abnormalities can point to electrolyte imbalances, ischemia, or other cardiac conditions. Bringing it all together, the QT interval measures the total time for ventricular depolarization and repolarization. It extends from the beginning of the QRS complex to the end of the T wave. This interval is crucial because a prolonged or shortened QT interval can predispose patients to dangerous arrhythmias, making its accurate measurement and correction for heart rate, QTC, vital in clinical practice. To capture this electrical activity from different perspectives, we use multiple ECG leads. Each lead acts like a unique camera angle, providing a distinct view of the heart's electrical flow. The standard 12-lead ECG comprises limb leads I, 2, 3, AVR, AVL, AVF, and precordial leads V1, V6, each offering valuable diagnostic information about specific regions of the heart. Congratulations! You've taken your first deep dive into the fundamentals of ECG interpretation. Remember, mastering the ECG is an ongoing journey of learning and practice. It's a cornerstone of cardiology, enabling rapid diagnoses and guiding critical treatment decisions. This content is proudly brought to you by Dr. Kumar from London Heartbeat Z Academy.